Meet the kidneys, those fist-sized organs that are shaped like beans. They are kind and hard-working organs located in your upper abdominal area, attached to the back of the abdominal cavity on either side of your vertebral column. Your kidneys have 4 important roles, so luckily we have 2 of them. They are essential for excretion, cleaning your body every day as it passes through them, by removing urea and other chemicals. However, sometimes your kidneys may fall sick. This may be self-inflicted, such as drinking excessive amounts of alcohol or taking drugs, or might occur as a result of another illness, such as diabetes, or experiencing severe injury that leads to a bacterial infection. This can cause kidney failure, which is when your kidney cannot function properly anymore, leading to a buildup of waste products in your body. As you can imagine, these waste products are dangerous, and them staying in your body for too long can cause serious damage. To help relieve the kidneys of this duty, patients can undergo dialysis for about 4 hours, 3 times a week. So what happens during dialysis? Patients sit in chairs, much like a lounge chair. A needle is inserted into the patient's vein, and untreated blood starts flowing into the dialysis unit. Let's follow this blood to see how it gets cleaned. A pump pushes the blood through the dialysis tubing, which is partially permeable to ensure that large particles like blood cells and proteins cannot leave the tubing. The tubing is suspended in dialysis fluid, or dialysate. Dialysis fluid is a special solution of pure water, electrolytes and salts. It contains no urea or waste products. No waste in the dialysis fluid means as the blood flows through the tubing, a concentrated gradient is created, allowing waste products to be removed from the blood and into the dialysis fluid by diffusion. The dialysis fluid also contains electrolytes and salts to help correct any other imbalances in the blood that may have arisen from the kidney failure, also making use of concentration gradients and diffusion. Sometimes glucose is also included in the dialysis fluid, either to remove excessive fluid from the blood or to provide the blood with more glucose if it's lacking. Once the blood is thoroughly filtered and cleaned, it returns to the patient through their artery. The used dialysis fluid is then disposed of. While dialysis can replace the work of a failed kidney, it can be very uncomfortable and time-consuming. For this reason, some people instead opt for kidney transplants. However, while these prove to be a much better long-term solution, as you will not have to eat a restricted diet or experience any discomfort, they tend to be very expensive, and finding a matching donor tends to be very difficult. Even if both conditions are met, you still might be at risk of your body tissues rejecting the transplanted kidney, which will require you to take immunosuppressive drugs. So remember to take good care of your kidneys, as they help keep your body clean and healthy.
How to help kidney failure patients who refuse dialysis. The kidneys are primarily responsible for separating urea, mineral salts and toxins from your body and conserving water, electrolytes and salt. They also balance the body's fluid and mineral content, regulate blood pressure, and metabolize waste, which they then excrete as urine. Kidney failure, also known as renal failure, occurs when one or both of your kidneys are unable to perform these vital functions. The best treatment is often dialysis, but some patients do not want to undergo this procedure. Start with step 1 to learn more about other methods. Taking medication and supplements. Take diuretics. Diuretics can decrease edema, swelling of hands and feet due to excess water in the body. Your doctor should prescribe drugs like hydrochlorothiazide or furosemide in doses specific to the severity of kidney failure. Furosemide is administered in tablet form or IV and is taken every day once a day until the desired effect is obtained. wh.performance.mark Step 1_rendered. Maintain your blood pressure with medication. ACE inhibitors, vasodilators, beta blockers, and calcium channel blockers can help keep your blood pressure at a healthy level. These drugs either dilate the veins or arteries, reducing either the amount of work required of the heart or reducing the amount of blood pumped to the heart. Ingest phosphate binders. Taken before meals, phosphate binders like calcium carbonate or calcitriol bind phosphate in the stomach and prevent it from being absorbed. A concentration of phosphate in the blood leads to weakening of bones and ultimately irreversible damage, skin irritations and itching, muscle cramps due to electrolytes disturbance. There are additional strategies involving dietary changes for lowering phosphate. Get vitamin D supplements. Supplements can help activate the vitamin taken from food or sunlight. The activated form of vitamin D helps regulate both calcium and phosphorus levels in your blood through balancing their absorbance. It also controls parathyroid hormone (PTH) release, which forces your body to increase calcium levels by taking it from bone tissue, which is ultimately not good for you. Take iron supplements to treat anemia. Anemia develops because of a decrease in erythropoietin (EPO) production. EPO help form red blood cells by stimulating bone marrow to produce them. When not enough red blood cells are synthesized, less oxygen is delivered to your vital organs, causing short rapid breath, fatigue, chest pain, confusion or dementia. Avoid non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen and diclofenac salts can harm your kidneys. Ask your doctor to prescribe you other safe analgesics.